when there's a lack of an aligned approach to early intervention between the teacher and the parent, that child is caught in the middle. And this is really, certainly for me, one of the reasons that we have this terrible epidemic. Because we miss the opportunities in early intervention to do what we need to do in order to prevent this from manifesting later as a 7, 8, 9, 10-year-old, because we saw something but there was just too much divisiveness and we couldn't deal with it effectively. We need a formal structure and process for teacher-parent alignment. So to begin with, let's just create a vision. Grant is 5 years old. He's a 5-year-old kid, sweet kid, 4 years old. He begins to show some kinds of signs of having difficulty with focus and attention, not really able to sit still, can have temper tantrums quite often. And you know, in the beginning one can think to oneself, well, he's 4 or he's 5, it's really developmentally appropriate. He's going to grow out of it. But if he continues to do that, I'd like you to imagine how it would be if the parents and the teachers worked together on this. And so the way in which this process would work is, as soon as you identify anything like that, or the parent identifies anything like that in terms of the child's behavior, you immediately get together and you ask each other, are you seeing this? Are you seeing this? Yes, I'm seeing this. Yeah, no, I'm not seeing this. And you decide what you're dealing with in Grant's case. Then you decide, you get together and you decide, well, you know what, we're not sure if it's developmentally appropriate because kids develop at a little bit different pace for each other. We will watch it for 6 months. In effect, within my scheme of things, something is considered to be a problem if it lasts for 6 months or more, and if it interferes with a child's ability to learn and socialize. And so the parent and yourself say, we're going to watch this together for the next 6 months, so we can decide whether we need to deal with it or whether it's actually developmentally appropriate. And you have meetings during those 6 months, just quick meetings, and how's it going, what are you seeing? In addition, what you do during those 6 months is that each of you, both of you, decide to relate to Grant, in this case, in the same way. You're going to use the same tools and the same skills and the same communication styles for engaging with this child in order to help the child to focus and calm and feel good about himself. So now, this is my vision. Imagine what's happening in these 6 months is you guys are speaking about this kid, but also what you are doing in your classroom with this child, mom and dad are doing at home with that child. So now what happens is this wonderful 4 or 5-year-old is getting the same kind of intervention. And then when it comes to the end of the period of 6 months, you get together and again and you say, it looks like it's working because we've seen a reduction of this, or it looks like it's not working, and let's teacher and parent decide what our next steps are. In this beautiful vision, that the parent and the teacher would see the healthcare practitioner. Each of them would see the healthcare practitioner work together and then decide on a roadmap or a plan of action, which once again would be implemented in the classroom as well as at home. So there's a consistent alignment. The changes in the children who go through this program is remarkable. In fact, the changes occur quite quickly, the positive changes. So that's the way I see the vision of this occurring.